In the spirit of introducing people who need no introduction, Dr. Braff.
In the spirit of thanking people who gave you a terrible introduction, who was that? I have my little stopwatch here, so my rule, in terms of mentorship, obviously we are both clinically and educationally and scientifically involved here. The first rule of good mentorship is explaining to people, if you have 15 minutes, you have 15 minutes. So I have a $18 Casio watch. I replace it every 3 years. When it hits 15 minutes, I just stop. And so that's one thing about mentorship is learning about boundaries or teaching about boundaries. I'm sure I'll screw this thing up. Let me see what I'm supposed to talk about. Yeah, that makes some sense. So my wife and my uncle-in-law, Arnold Lazarus, were very interested in Adlerian psychology. Not that it's therapeutically that useful, but one thing in terms of mentorship to convey to students, and students can sometimes convey it to mentors, is the spirit of Gemeinschaftsgefühl, which is the sense of community spiritedness. And I think you've heard about it this morning, the cohesiveness that we have. And if you start out with somebody, a mentor or a mentee, who has that sense of Gemeinschaftsgefühl, you're halfway there. Some people do have it and some people don't. So in terms of mentees' voyages, this is really for another purpose, but I've adopted it. In these turbulent waters that we navigate, how do you pick a mentor or a mentee? I say turbulent waters because we deal with, I was just driving down here, I see that Scripps says, they have that plastic size banner in their hospital, #1. They don't have a psychiatric unit, I don't think. Psychiatry counts, if you look at days of disability, we're in the top 3 for sure, maybe in the top 2 or 1. Other people may know more than that. The turbulent waters we have is that psychiatry is still an underrepresented specialty in terms of resources and parity. And so your voyage is a more difficult one than others. How do you pick a good mentor, or how do you pick a good mentee? I use this slide in a number of contexts. When Fred Astaire, I hope you all know who Fred Astaire is, or maybe when Fred Astaire was interviewed by numerous studios, 3 of them came back. They came back this way: cannot act, cannot sing, is balding, which I feel is the worst thing that they said about him, can dance a little. It's very hard to evaluate when you enter the mentor-mentee relationship if it's going to click or work. Some people look stellar. By far the best, I did my residency at both Yale and UC San Francisco. The most promising resident just sort of disappeared into a basement cave of some kind. Here's the wisdom of Sid Zissek. So I've actually, compared with the science talk I gave, I've really struggled over this talk because it's a heterogeneous audience. I've given talks like this to many young scientific groups. And this is a little bit different. So Sid, in his usual unoptimistic way, says, stop preparing, just talk spontaneously about some of your favorite mentors meant to you. I'll get to the mentors. Let me talk a little bit about the mentees. Alan Abrams. So I come to UC San Diego. I'll tell you why in a minute. And Alan Abrams, Alan, I think you were the second chief resident. We were just talking. And guy comes in. He has no research residency. He has 20 publications. He had worked extensively with David Janowski. The most wonderful, not the most wonderful, because I have to talk about others, an absolutely wonderful person. And that year was so much, it is instructive for me. I think he had a garage full of books and he read every one. I don't think I've ever met anyone in training or post-training who had read so avidly. So I think that the relationship was rewarding for him and rewarding for me. We'd shared a kind of thirst for knowledge, and I knew that the inpatient service was in good hands with him if I wasn't there. Kristen Cadenhead. So you have a mentee who, she's now our residency training director, and what could be more gratifying than having someone doing a great job with the residency, who's a wonderful person, in terms of what you dream about, which is that, you know, transgenerationally, you're going to have some influence. Of course, having Kristen was also a pleasure as a chief resident. The same year Kristen was there, Nancy Downs was also in the residency. And Nancy was an absolutely wonderful resident. And I'm talking about and this is what keeps you going as a mentor. You have people like Nancy, who, of course, does our college health program. And she was competent, sharp. But then I think about all the good she's done. Neal Swerdlow, of course, our director of residency, psychiatric education and training, who came to me and proposed an animal model experiment that was far beyond my ability to understand in complexity. I mean, she's like poison nucleus accumbens with a dopamine poison, and then challenge the animals with low-grade amphetamine. Huh? Trying to replicate schizophrenia. And Neal and I have, of course, worked very closely for many years. And Greg Light, who's the deputy director. So all of these people have had, and Alan has done a lot with the criminal justice system in California. So what could be better? This is better for me and better for them. The idea that they gave something to me in terms of I learned from them, and hopefully they learned something from me. So, you know, I've trained hundreds of residents and more than hundreds of medical students and others. And will say one thing, in the 2 science days, when things are sort of falling apart, research-wise, I always can go back to the patients I've helped and the people I've helped in terms of their training, because that's palpable. Some nonlinear analyses of EEG are not so palpable. And then, of course, Sid said, our young colleagues must understand and experience the importance of a good human mentee relationship. And all of these relationships have meant a lot to me, and I believe to them. So how did this all start? Well, I had, born on third base, thought I hit a triple. Tim Beck and Arnie Lazarus, when I was at Penn and then started my residency, short-lived residency at Yale. I only lasted there 1 year. I'll tell you why. Tim was an incredible mentor, and I still am in contact with him. And of course, he won the Lasker Prize. And you know, watching carefully, I saw a lot of patients with both of them, ran groups with them. I had incredible mentorship, and I really benefited from it in terms of really digging into difficult clinical issues while we were, me in a very minor role, developing cognitive behavior therapies. At the time, the psychoanalysts just thought we were wasting our time, and of course that turned out not to be true. What Arnold taught me is I was listening to him lecture one day, and I thought, I can take some things away. Arnold had the English accent, which gave him a 10, 15 IQ point boost. And I thought, I shouldn't try to be like Arnold. I should really try to be like me, because I couldn't be like Arnold. He did incredibly imaginative things with patients, and that has stuck with me. For instance, I saw a patient, I don't think I have to anonymize. I saw a patient, and actually I referred this patient to Pat Judd. And she wouldn't go, I think, after one visit, or because she got a right turn instruction instead of a left turn instruction. She was 5 minutes late, and she held it against Pat because somebody else had given her the directions. These are boundary problems, like major boundary problems. So I said to her finally, after 3 referrals that she couldn't keep, I finally said to her, look, I'm gonna propose, this is an Arnie Lazarus thing. I never saw him do it, but let's say that I could send you. She wouldn't go to someone in North County because she had to drive there. Her parents had bought her a car, but she didn't like the drive anyway. But she didn't have a job, and she was aggressive at times. I said to her, look, let's say you could make 3 visits up to Carlsbad, and at the end of those 3 visits, you wouldn't have any more problems suffering. Your impulses would be great. You'd have good relationships. Would you make those drives? And she said, no. I told you, it's too long a drive. See, so sometimes you have to, if you probe people, you have to realize, wait a minute, that there's nothing that's going to work. And you have to understand the limits of your patients. Most people can be helped modestly, but in our field, there are some people with intractable disorders. It's usually not somebody who's not psychotic or something, but I always remember that because Pat was, I love Dr. Judge. She was so helpful, but I won't go back because I think that the receptionist was mean to me. There you go. Then I left Yale because of these 2 guys. Psychoanalysts were running the Yale VA, and they just started out, they hated me because I was cognitively, because I was related to Arnie Lazarus. He's my uncle-in-law. I said, well, I don't understand. And then a number of things happened. I couldn't understand. I was a really good resident, conscientious, I think, but I realized that it was just wrong for me. Now Yale under John Crystal is a great department. So I went to UC San Francisco. I didn't have a plan. I went to San Francisco not having a residency, but fortunately for me, unfortunately for the decedent, one of the residents suicided, and that was a joke. What Notch taught me was intellectual curiosity. Don't be afraid to take all possibilities into account. And he was transcendently kind. On my 15th basketball injury, I couldn't really do very much for 2 years, and I just kept getting paid. I thought, this academic stuff is great. You know, you could come in on the bus from Mill Valley, lie down at UC San Francisco on a couch, see some people and do a minimal amount of stuff, and you still get paid. Boy, how wrong I was. Here's another thing for screening mentees or mentors. Why Nordstrom's? Oh, well, I'm running very late. Why Nordstrom's? Here's why. John Nordstrom was asked, well, how do you train these people to be so terrific? And he said, I don't train them, I hire them. Their parents train them. It's very important in terms of temperament to understand what you can and cannot do as a mentor or as a mentee. We have degrees of freedom, but they're somewhat limited. This is just a list of things. Let me just see what I'm not going to. I want to get to this one, the wisdom of Neal Swerdlow. Let me just say, in terms of people that you could be proud of, Neal did the research residency, which I think was doing okay. And he got a perfect, he came in and he said, I got a perfect score. I said, what? You got a perfect score? I thought, well, he managed to not listen to me enough to get a perfect score. I mean, this is very unusual for NIMH. In terms of what you look for, if you are a mentor or a mentee, here are just some characteristics, and then I'll end there. Maybe I may inflict one more slide on you. Social cognition is very important in schizophrenia research now, but it's very important in interactions, that people are not socially apraxic. Humility with reasonable goals on both parts. A willingness to actually work. Greg Light and I interviewed a candidate for MIREC, our Mental Illness Research Education and Clinical Center on Psychosis at the VA. And so I finally, something wasn't right after about 2 minutes. In 5 minutes, I have a sense of people. And I said to her, but why do you want to do neuropsychiatry? And she said, because it's easy. Well, I think people in the audience know that's hardly true. So that was kind of the end of the interview in my mind. We went on for a little while. Curiosity, accurate empathy, and a moral compass. And in terms of a moral compass, I always relied on David Siegel to some large degree as a moral compass, and Sam Barandes. Another person who was a good mentor, although we didn't had that, well, he was my boss, I guess, as the chair. Lou Judd once said to me, while I was tilting at windmills again, he said, "Is the juice worth the squeeze?" I never thought of it that way, but actually I realized I was wasting about half my time on projects and things, often, taking the high ground morally, but things that just couldn't work. And I always remember that. Now, I will go to the last slide. I won't do this. This just shows how hard it is to see people for 20 minutes. Here's what we're faced with now. This little girl in central Mexico has cleft lip, cleft palate on the left. Her, because of social beliefs about why this occurs, her life is doomed. In 1 hour, surgeons from, I think, Mercy go down and set up a field hospital because people in central Mexico don't trust the central government, and her life is totally transformed. Unfortunately, in schizophrenia and many of our disorders, this is not true. You've heard this morning, and we'll hear the rest of the day, about the rapid advances we're making, but despite the rapid advances, we're still at the very early stages of, these are some of the things that we do. Our future is up to 100 years. Maybe in 100 years, they'll look at us as people who are bleeding people, with eels. Who knows? But some of these things like direct-to-consumer testing is actually just very misleading. And some are, like esketamine, may be very effective. So in this menu of things, as a mentor and as a mentee, we have to evaluate these things very critically. So I wish you, especially for the mentees in the audience, it's a challenging and it's the best time to be a student because we know some stuff, but there's a huge amount that we still have to learn. And good luck on navigating. I always say patients navigate through their life. Good luck to all of the mentees, especially as you navigate your careers. Thank you.
Thanks, Dave. We'll have some time for discussion and maybe some questions later. But I must say that David has really been a great teacher. People miss having him leading the inpatient unit where he actually served as a role model, a supervisor, and a mentor for all of our residents through the several years of time that you were running that unit. And you spawned some of the best psychiatrists in San Diego. So thank you for that.